seen some great practice-changing research at this Congress.
There's lots of good news for lung cancer patients.
The new immunotherapy which has been coming out, this information will definitely help us to develop treatments and benefit patients.
So many new drugs and new developments.
I like presidential symposium.
I find it very interesting, very good.
And I'm impressed by the number of delegates.
For the lung cancer, it's very interesting.
Very well organised. It's been very pleasant.
A lot of new information for me.
Last day in Copenhagen. Total number of participants 20,522. Unprecedented number of simultaneous publications in high-ranking medical journals. But how can we make all these innovations available to patients?
We have seen innovation in patients with different diseases, including melanoma, non-small cell lung cancer, ovarian cancer, and other tumor types. So this is really good. We have very good news for patients. But at the same time, we have been discussing in several meetings and in several sessions how we can make that all these drugs, all this innovation becomes available for all patients. And actually this is very important because ESMO is a worldwide society. And basically I think that as other efforts that are being done by other societies like ASCO Society and also NCCN platform, also Bacchus, we think that it's very important that all of us discuss with all the stakeholders how we can favor the access to our patients of all this innovation. And it's not only related to innovation. For different reasons, even drugs that are not expensive at all cannot be available in many countries. So the discussion on the accessibility to innovation, not only to drugs, but now specifically to drugs, is related on how we can favor from ESMO. Policymakers actually could take in consideration and help to make these drugs available worldwide.
No one can remember any big congress that has such a wealth of immediately practice-changing data. I would pick the phase 2 Keynote 021, which massively improved on chemotherapy, extremely high response rates, extremely promising progression-free survival.
This has been the meeting focusing on ER-positive subtype for breast cancer. We have learned data from the Falcon trial, who actually tested the use of fulvestrant versus anastrozole as first-line therapy for patients with metastatic breast cancer. And we saw that fulvestrant, as previous data already suggested, is superior to anastrozole for these patients. After the presentation of the Mona Lisa 2 data, taking into account data from the Paloma 2 trial as well, we have to acknowledge that from now on, the first-line therapy for patients with ER-positive metastatic breast cancer is going to change.
There was a study presented by Julie Baumann that expressed the recommended phase 2 dose for ipilimumab that combined with cetuximab and radiation. That was 1 milligram per kilogram. This is quite interesting because we evaluated that the dermatological immuno-related events outside the field of radiation were the dose-limiting toxicities. Then we have the update of the meta-analysis of the Merck group regarding the chemotherapy added to local regional treatment. There was a confirmation that concurrent chemotherapy is the state of the art and is better than induction chemotherapy.
We have a revolution in the CNS tumors based on the new WHO classification that integrates histology plus molecular biology. We are starting new trials on combination between immunotherapy and the chemotherapy. We needed to study new anti-angiogenic agents, and we wanted to integrate radiotherapy plus these agents.